bruises, just as if you were to bruise your hand or hit your thumb with a hammer on the surface of the brain inside the skull. Those are subarachnoid hemorrhages, the small ones, but they are actually the worst because they are typically missed, and those patients do end up frequently with epilepsy. And we would call it mild traumatic brain injury because there is no obvious bleed in need of surgery the day it happens. A subdural, for example, would be an obvious need for a surgery evacuation, but it would be only moderate traumatic brain injury because a subdural is placed in the between layers of the brain lining and the skull, so that the brain is almost protected from a direct injury or contusion to the brain tissue itself. Subarachnoid affects brain tissue and causes a scar that leads to epilepsy, and it's inside the thick skin membrane of the brain and of course inside the skull. A subdural is between the thick membrane and the skull, and so it's a little bit, the brain is farther away and it doesn't suffer from the bruising and of the bleed and the hemorrhage deposits that later cause scar tissue and epilepsy.
Okay.